Good morning, everyone. It is 9 o'clock, so we're going to get started here. My name is Cassie Hopkins, and I help coordinate the webinars for Hausman Johnson Insurance and the Benefit Services Group. We're so glad you guys can join us for our webinar on critical contingency and cleaning plans, updating your cleaning protocol during COVID-19. Whether you're joining us from the office with some coworkers at that 6 feet distance, or you're in your home with children, family, furry friends, we're glad that you can just join us to learn more about this very important topic. Just some housekeeping items before we get started with our panel. This presentation will be recorded, so you will be able to get the slides as well as the video recording emailed to you for anyone who registered. During this webinar, we are going to do live question and answer sessions. So if you have a question, type it into the question feature right away, and our speaker will address it right away as well. We will also have a little break in between Rick and Jeff speaking before Scott takes over from CleanMark, and we will have a little bit of a break as well to do a Q&A session. We will also have polls in this webinar that we are hoping you can answer. This is just some way for us to all see where we're at as a community and for a way for us to help you guys as well. And again, this presentation will be recorded. We're going to have a short survey that we're hoping you can fill out for us, letting us know what you thought of the webinar, what you thought of the speakers, and any recommended topics you'd like us to do more webinars on. So with that being said, I'd like to turn it over and introduce our panel. We have Rick Barton, CSP ARM, who is the Manager of Risk Control Services here at Hausman Johnson Insurance. And we have Jeff Dutton, who is our Risk Control Consultant who works with Rick, and they are our safety team. We trust them with any safety questions, so you are welcome to answer or ask any questions that you have. And then we also have Scott Stevenson, who is the President of CleanMark Services. And with that, I will turn it over to our panel. Welcome, guys.
Morning. Good morning, everyone. Good morning. This is Rick. I'll be the first one up and taking you through the journeys of COVID-19 and some of the contingency planning that we have been working with, not only with our customers, but with other individuals. And we'll go through some of those issues. And then we'll get into a little bit on what to do if someone is sick. And then finally, we'll turn it over to Scott. He was going to talk a little bit about cleaning protocols and what needs to be done in order to keep your environment safe. And if you do have a suspected case, what you need to do for making the facility safe or this job site safe for future work. As we know, this issue is not going away soon. It's projected to be peaking in about 15 days from now in the US. And as we know, it started in China a couple months ago, and it became a pandemic probably about a month ago or so. The public health emergency of international concern started in January, and I think we all know what's going on regarding the number of cases and this escalation. So we need to be concerned about this. We also need to be worried that, or not worried, but make sure our employees are safe. This presentation will be really focused towards what we call essential businesses. We know that many businesses have shut their doors now, but there are businesses that are considered essential. In the state of Wisconsin, Governor Evers has indicated that essential businesses can work. One of the things that they suggest is a heavy contingency plan. It is not mandated at this point, but it is something to consider. And if I was wearing your hat and working on your side of the aisle, I would probably say it is a must that you have a contingency plan, or if you want to call it an exposure control plan, we need to have one of those in place so that we protect our workers. So we need to be aware of that. Cassie, there we go. Just a little background, we're now up to 190,000 cases worldwide. That may have gone up since this morning when we updated this. Obviously, we've got over 4,000 deaths, and even in Wisconsin, we're up to around 28 deaths, 1,400 cases. And like I said, that is not going to be reduced. Obviously, it's going to go up in the next 15 days. So let's be aware of that. One of the things that we take much of our information from and follow is the CDC guidelines. Those guidelines are put together by experts in the field. The whole issue we wanted to cover today about, excuse me, contingency planning is what are you doing to comply with those guidelines? All right. As you know, this COVID-19 is really spread between people who are in close contact. There's a lot of talk about social distancing. It does make a difference. We're going to talk about that. And what this is basically small respiratory droplets produced when an infected person coughs and sneezes and gets onto someone else. The problem we have is then we also touch surfaces that may be infected because the virus does last up to 72 hours in the air or on surfaces, depending on what that surface is. And then we touch our nose, our mouth, eyes, and then we become infected. So we need to look at some of the protocols, and that's where we're going to get into cleaning and sanitizing before we get into some of the other issues that we have. Let's move on to the next slide. It's a great depiction of how this does spread throughout our environments. As you can see, it doesn't take a lot, and those droplets do expel quite a ways away from someone. I have seen some customers that have actually put up a social distancing sign where they actually show you what 6 feet entails. It's a lot farther than you think. If you're sitting across the table from someone, you're probably closer than 6 feet. If you're sitting behind a desk, you might be 6 feet away, but you'd be surprised how far that 6 feet is. So the transmission and infection can happen and be latent for quite some time. So sometimes we don't even know we've been infected, and we need to be aware of who we've been around and what we've been doing.
We are having some people comment that the volume is going in and out. Is there a way you can keep the microphone close to your mouth so that people can hear it?
I will try and do a little better job at that.
Thank you.
All right, is that better? All right, very good. Let's move on to the next slide. As we get into the contingency plan, my question, and the question that we would probably have for everyone, is do you have a contingency plan? A contingency plan is critical dealing with this and or any other type of airborne type disease. You almost can relate this to your bloodborne pathogens program, but for this purpose, we're going to talk specifically about the COVID-19 and what we need to do. What will your business do to prevent the spread? Do you have this plan in writing? Is it available for your workers to review? Many of us probably have a plan, but we probably haven't put it in writing. If we did, that's great, but have we shared it with our employees, and are we reviewing it on a regular basis? We don't only do this for protection of our workers, but we do it to comfort our workers. So we need to make sure that we do have a plan that's available in writing. The other thing we need to do in that contingency plan is develop a plan on what do we do once we have detected COVID-19 in your place of employment. What are we going to do in terms of isolating that area? I'm going to let Jeff talk about that in a little bit. Next thing we have to do is what are we going to do to better assure that we reduce or have a reduction in that spread in our workplace? Are we taking the proper cleaning protocols? Are we separating and using some of the techniques that the CDC has provided for us that do work if we use them? And then what are we going to do if we do have to close our business for a time being or for a short period of time because we do have a case in our facility? And that's going to be something that we're going to have Scott discuss and go over. So what should your contingency plan consist of? Let's talk about that for a little bit. I think we need to be aware that your contingency plan needs to have several items in it. What we have done in the next several slides is we've put together some of the highlights that need to be in your contingency plan. They may not be all encompassing because each individual business is going to be different, but I think you'll see a lot of commonality between them. And so we wanted to provide some of the contingency planning requirements that are necessary as we go through and develop this plan. So if we flip through the next few slides, we'll see, or go to the next slide, you'll see one of the biggest things, and probably one of the most difficult things, is banning in-person meetings. I think we're doing a pretty good job with the shelter in place now. We have a lot of employees working from home, but we have a lot of essential businesses where you just can't perform your work at home. You work in a factory. You can't take that equipment home and work on that product. You work on a construction site. You can't do that at home. You work at a place of business that may be providing groceries or essential products. We can't do that from home. So what are we doing to limit? It says ban in-person meetings. It doesn't mean we're going to eliminate them. We're going to try to reduce those meetings and reduce the size of those meetings, and also try to deal with the social distancing. It's employee communication whenever possible. We're encouraging people to do it virtually. You'll see that if you saw all three of the panelists right now, you'll see we're all in different locations, including Cassie. So we are virtually separating and doing this virtually, and we can do a lot of things virtually for the time being. It may not work great, but at least we're getting through it and we're providing some distance and separation. One thing that you may want to consider is, as part of your contingency plan, what are you doing to monitor employees on a daily basis? We're suggesting that you actually take their temperature when they come into your facility, on your job site, or whatever type of environments you have. You can get a thermal scanner, and you can do that without contact. I will suggest or recommend that if you're going to get one, you better sign up now, because they're still about 8 to 10 days out before you can get one. They're in very limited supply, but we can get those and we can use those. If you have one, great. The other thing you need to do is, if you are, and when you are doing this, you need to log in all the people that you are scanning. This needs to be done not just for a select number of personnel, but every person that enters that facility, that job site, or that location. And we need to have someone that monitors that. I would almost recommend that you have a COVID-19 champion that is available for monitoring or overseeing this process. If you don't have the ability to do the thermal scanning, you can use the 4-question survey here that is used at many sites that do not have the equipment as of now. And you can see that on the screen, basically asking employees whether or not they have been in areas where they've been within 6 feet of someone with COVID-19 in the last 14 days, whether they've had a temperature of 100.4 or higher, and along with that, any signs or symptoms such as a cough, shortness of breath, or difficulty breathing in the past 14 days. Or are they currently experiencing any fever or symptoms or respiratory illnesses such as coughs currently? The whole issue here is we need to make sure that we are monitoring people coming into our facilities, so we're not bringing the illness into our facilities, and they're further reducing the amount of people that we may have available for us to work. If we keep our employees healthy, we're going to be able to continue to work as essential businesses and keep the process moving forward.
Also, I just wanted to add to something to that, Rick, is that if anything changes during the day also, that should be documented so that you can get the information about who's been in contact with that person, so that we can reduce, or we can concentrate on the area that that person was working in, and if there's been any exposures, to get those people isolated immediately, so that we don't chance the spread of this disease.
Yes, that is correct. The last question, and I skipped over it intentionally, is the travel question. We also want to find out if anyone has traveled in the last 14 days and where they have been. I think that is also very critical. I can just give you a personal experience. I have a daughter that traveled. She was in Spain. She had to bring a plane back. She's in the military. She had to go through Canada because she got trapped there for 7 days. She's now in quarantine for 14 days. No signs of symptoms, just a matter of policy. And our company should also be following those policies. The potential for that spread to be there is real, because it can be latent for several days. We don't even know they have an exposure. and we need to make sure that we don't provide that exposure to our fellow workers. As we move forward, we also have to have several other items in our contingency plan. Think about some of these and think about how you're doing these. Are you doing them, and are they serving the purpose that they're intended for? Reducing shared spaces such as break rooms. There are a lot of facilities that they're not even using their break rooms as a break room anymore. They're having people take lunch in their work areas. Not always feasible. If they do have a break room, they're cleaning it very frequently with disinfectants, and I'll let Scott talk about that a little bit later. Bathrooms, we can't eliminate the use of them, so we need to make sure we're cleaning these places frequently. Are we looking at staggering our employees' time of start and finish so that we don't have entrances that are populated with hundreds of employees walking in at the same time? We need to look at that and see what we're doing to reduce the amount of contact with other employees. Again, trying to follow the social distancing requirements. And then the mandatory work at home. Many of us that are probably on this call are mandatorily working at home because we may be able to do much of our job virtually. But we need to make sure that those employees that aren't working at home, that we do take care of them. And we need to make sure we only have the essential employees that are there to get our product out the door at that time. I think if you look at the next slide, it's a little slow, but get through this. Take a look at your sanitary processes. I'm not going to spend much time on this because Scott's going to spend several minutes going over some of the requirements and what needs to be done in this area. Another thing that we see often is blue tape marking of surfaces that receive frequent human contact. Those areas will be marked so that we make sure we disinfect those on a regular basis. These surfaces may require more attention than other surfaces. They might be high traffic pattern areas. They might be items that we use frequently. We also want to try and reduce the amount of common tools used by several people. If we can reduce the use of tools to just one person, maybe issue everyone a set of tools that they need for their job and they don't share tools, we can reduce the spread of this potential infectious disease. We don't want to share any type of food preparation materials and things like that. So those are some of the things that should be outlined in your contingency plan, and they may be very specific to your organization. The next thing is, I think, pretty well received, is that we're not probably going to be doing any international travel in the near future. If there is any reason to do any international travel, it must be for critical purposes only. For that matter, we also want to reduce our domestic travel. There's actually been talk of states not allowing other people into their states. That has come up recently in the chat rooms, that there is going to be some domestic travel restrictions. If you go over a state line and then come back to your state, you may have to self-quarantine for 14 days. That may be something to take a look at depending on where you are. That may be a struggle for those of us that may be close to state lines, and we do have to go over the state lines to complete our job, or we're getting employees from across the state line. So that is going to have to be an individual company decision. Again, the last thing on this slide, any employee returning from any country must self-quarantine for 14 days and then be symptom-free. And you want to be symptom-free for at least 72 hours without using any pain-reducing medication. So over-the-counter or prescription drugs cannot be used to reduce your fever or any pain that you may have from the virus. So once you're quarantined for 14 days, we may still have to wait a couple days to make sure that we do reduce our potential spread of this disease. A couple other things you want to put in your contingency plan. And again, I just want to reiterate that we do have formal contingency plans available on our website that we put together that you can use. These are just excerpts from. We want to reduce the deliveries except for those that really support our production. I know we're all going to have deliveries. We got to make product. We got to do certain tasks. We can't build buildings. We can't make products without raw materials. But if we are going to receive those deliveries, maybe we have an area that we receive those, and we treat those delivery people just like we treat anyone else that enters our job site. They have to have, if they're doing thermal scans, they have to have proper personal protective equipment when they exit their vehicles and things like that. Visitors may need to be reduced. Critical visitors probably would be excluded from this if they have to inspect something in order for the process to move forward, or they need to be there for real serious business meetings. But we want to reduce the amount of visitors that come to the sites so that we don't have spread coming from unknown areas. Again, all visitors are also going to go through the same entry procedures that any employee goes through, and so forth and so on. The last thing I wanted to mention under the contingency plan is you have to have an immediate report system set up for any COVID-19 exposures. I think this is really important that all employees are informed of what the signs and symptoms are. We're probably doing that, but we need to reiterate this. We need to train our employees thoroughly. We may also need to do some training in some other areas like personal protective equipment, things of that nature. Employees must be able to report any contact with any person who tests positive for COVID-19. The employee must subsequently self-quarantine themselves. And this is very difficult because employees, they want to show up to work and they want to do their jobs. They don't want to stay at home. And so they may not feel the signs and symptoms, but they need to understand that if they've been exposed to someone that is tested positive, they need to also quarantine themselves so we don't spread this disease. Essential manufacturing is something that we are looking at as a luxury at this point, and we need to make sure that we do take these steps so we do reduce the potential for this spread. So essential manufacturing personnel should be evaluated in the testing queue. We may want to get some of these employees, as the tests become more available, get these people tested so we know that they are not carrying the virus. Just this morning, maybe even last night, we know that there are some tests that can be done. I know they're not readily available, but they should be down the road where within 5 to 10 minutes, we should have an answer on whether or not they're carrying the COVID-19. Again, keep in mind that the contingency plan items we talked about are minimum requirements. They should be in writing and they should be available to your employees and reviewed with your employees as we move forward.
So I'm going to launch a poll here for the attendees. Feel free to answer or not answer. It is distributing the poll right now. All right, looking great. So it looks like 60% do have a contingency plan in place.
Great. That's actually higher than I anticipated. As we survey the workforce that we're working with, we find that that's one of the reasons we wanted to put this webinar on. Is we are finding many employers they have a contingency plan. I guess the next question is it in writing and has it been communicated thoroughly with your workforce? I think that's very, very critical. So just keep that in mind. Again, we understand that every company is going to react a little bit differently. So if you need help, again, remember that Hausman Johnson, we can help you developing that contingency plan. We have some models that we work off of. We can assist with any training, provide materials. We could even perform a risk assessment if that's what's needed. And then obviously Scott has the ability to do some cleaning services. So I'm going to turn it over, excuse me, to Jeff. He's going to talk a little bit about what to do when you do have something going on in your workforce. So Jeff, have at it.
Okay, good morning, everybody. So what happens if someone is sick with COVID-19? You definitely want to make sure that you're taking that person out of that area. You're getting as much information from them as you can find out who they've been within close proximity around, and making sure that person's informed also. We want to make sure that they're going through a 14-day self-isolation. And they should be going, just like Rick said earlier, 72 hours without any symptoms. These are just precautions that should be taken, because there is an incubation period throughout this sickness, so that if you go through the 72 hours, it's usually 72 hours after you've been exposed that these symptoms can arise. So that's why you need to keep track of what you're doing, what the symptoms are. And if somebody has come up positive, make sure that you're contacting the local public health department so that they have the information about the exposures. The more information they have and that they can release to the public, it helps us with the tracking and making sure that if we're not getting those exposures, that we're getting the good information to know that we're hitting that line, that so that we're not getting more exposures out there. Next slide, please. Make sure the medical evaluation is completed. Get in touch with their primary care physician if they have any symptoms that they've been experiencing. And as an employer, as persons, you want to make sure you're investigating this just like it is a workplace injury. You're taking care of the areas that have been exposed and cleaning those areas. I know we're going to get more into that with Scott, but if you can do some of the surface cleaning in those areas, there's a mixture of say bleach and water that you can use on some surfaces that you can clean that area up. And it'll also, with this investigating, it'll also assist with the determination of work readiness and of the confirmed case or exposure. Next slide, please.
We had a question come in here. It's more of a comment that if you could address. I've seen that it is not your responsibility to contact the health department. The provider that gives the COVID-19 test will contact the health department with any positive test, and then the health department is supposed to contact the employer on next steps. Can you address that?
Well, okay, yes, I can address that, and yes, you're correct about that. But to give more clear, concise information, it would be just like, you have to understand that maybe this can go to a place where OSHA would want you to report this. You know, this would be in your record keeping, so that you want to make sure that you're doing these things, because if you do have a case, and I mean, this is just speculation right now, but we're going to get to a point where when this starts to die down, and if you have some of this happen, if there's a reports of, okay, your business has had X amount of exposures, and OSHA is investigating and sees that it's not on your records, that could come against your company, and that can cause some fines in that. But I think that it would be in your best interest if you did report these things to the health department.
All right, thank you.
Again, you want to close off the areas that if you have a sick person. If you're in an office situation, open outside doors and windows if possible to increase circulation. That can also go for factory. And wait 24 hours before you clean or disinfect the area. This comes directly from the CDC. These are steps that you should be taking right from them. Some areas you may want to have When you do disinfect, they say keep those areas wet for a period of time to let the disinfectant work a little bit before you start to bring people back in. Clean and disinfect all areas. Again, just like I said, and things like offices, bathrooms, doorknobs, nice surfaces, tablets, touch screens, anything that you can think of that's coming in contact with people, railings, on job sites, on construction job sites, ladders, they should be cleaned on a regular basis. And you make sure that anything that person that has been has been infected, you're making sure you're cleaning all those areas very well to make sure you're cutting down the contact areas and to prevent somebody else from getting sick. So how long does it stay on surfaces? For copper, it stays on for 4 hours. If it's on cardboard or paper, it stays up to 24 hours. On plastic and stainless steel, up to 72 hours. So not only if you sneeze and it's in the air, and that usually stays in that area for at least 3 hours, this is how long it stays on surfaces. So you have to be aware of these surface areas and how long they stay on it, and if somebody is infected, how long before these areas are going to be infected before you clean them up. And disinfectant, the EPA on the CDC website, they have EPA registered household disinfectants, which you can use. You don't always have to have a service, but they do give you suggestions of stuff that you can use. And I know everything has been, a lot of things have been used. You have hoarders that have really stocked up on some of these items. So there's other things that you can use. Just like on the next line, it has diluted household bleach. I do believe it's for a third of a cup to a gallon. That's what the solution would be that you can use for disinfecting surfaces. Do we have any other questions at the present time? So if not, we're going to turn this over to Scott, and he's going to take you through the disinfecting processes that he goes through with his company. Scott?
Good morning, everybody. Scott Stevenson, President and CEO of CleanMark. We are a commercial cleaning company and a distribution company of janitorial products based here in Madison. For coverage, we covered northern Illinois, the entire state of Wisconsin, and eastern Minnesota area. Our focus is in office. We do a lot of medical, biotech companies, pretty heavy in manufacturing. We do education, but fairly light in education. And then I do a couple of food manufacturing companies. So the reason why I mention those verticals is we feel that we're very specialized in those verticals. I have some experience in retail and some other multi-venue cleaning. Back in the days, we did bars, restaurants, but like I said, our main focus these days is office, medical, and biotech and manufacturing, those 4 verticals. So I am happy to see that you guys, for the most part, have contingency plans, because what I'm seeing out there, the phone calls we're getting is the central businesses do not have a contingency plan, or if they have a contingency plan, it's one that they put together, probably in the last maybe 5 or so business days, and it needs some work, is what we're finding out. So I'm happy to see that you guys have some. I've already started some contingency plans. I think there's a lot of good information that Hausman Johnson just provided to take a look at those contingency plans and make adjustments as needed. So that's one thing we're seeing with COVID is once you have a plan, it seems to need changing in 24 hours. Hey, Cassie, can I draw the slide?
And I think this can be addressed to the entire panel.
Can I
Yeah, for
draw
sure.
the slide? That
So-
is me.
Yes.
Hello?
So we had a question come in from one of our attendees that I think the whole panel could address.
Okay.
Sorry, it's like we're having some technical issues. The PowerPoint is not clicking through. So here's the question. In regards to taking temperatures and logging, is this not a direct violation of HIPAA and ADA? Does this not have to be completed by a certified healthcare worker in a private setting? These guns are also unreliable from what I have heard.
I can take that one. There is no problem with HIPAA or ADA from what the attorneys have told us. The other issue that we have also found is that there are guns that are not accurate, and that's why you need to be specific to get a body temperature gun. I've had people ask me if they can use a thermal scanner that's used on equipment. They are not accurate. You need to get a specific type of thermometer that can scan and is very accurate. And the CDC does recommend this, and the recommendation does follow CDC guidelines. So it's not outside the realm of something that we can do at this point.
Thank you very much.
Go ahead, Scott, you're up.
Hey, Cassie, I'm still having a hard time driving. Can you go to the next slide for me? All right. So we've already talked about the CDC. The CDC is basically our Bible when it comes to procedures and products. We refer to the CDC on a consistent basis. So what I'm about to present is all information from the CDC and our manufacturers that are in line with the CDC. Next slide, please. Okay. All right. So we talked about avoiding crowds in the workplace. If you have employees that are not feeling well, obviously you have your protocol. They are to go home, at home, stay indoors. This has been really difficult for my kids. I have 4 kids ranging from 7 to 16. We're allowing them to go outdoors, but it's on their bicycle or in their backyard. We haven't had any exposure to other kids for about 2 weeks now. In relation to cleaning services, I'm going to highlight this a couple times here. This is some practices that we're taking here in the workplace and also at the home. These are some of the things that we're going over with the kids. Next slide, please. All right, so cleaning. 6 weeks ago, our focus was on emptying 100% of our trash cans. That was our one major metric when we were talking to our clients. Now things have changed. So now there's a less emphasis on the trash cans and a heightened emphasis on the cleaning, sanitation, and disinfecting of the facilities we have. So we have, in essence, 2 clients we're serving right now that are, one are essential businesses, critical businesses in the eyes of our government here in the state, and then the other is non-essential services. So those non-essential services, we are still cleaning those facilities, but it's more or less getting ahead of the game with them, doing detail cleaning, dusting, carpet shampooing. Basically what we're doing is we're getting those clients ready for reopening when they go back in business, which hopefully is the end of this month. Now, the essential businesses, we are doing the cleaning processes of removing the germs, the visible dirt, and we're also sanitizing, and in most cases, we're doing a heightened disinfectant program. Now, why I take you through these series of cleaning, sanitation, and disinfecting is if a work surface isn't properly clean, so we see on a hard surface that COVID can stay on that surface up to 72 hours. If that surface has debris on it and we come in and we sanitize or disinfect, it's not going to do anything. So it's very important that the first thing we do is we come in and we clean, wipe down that surface, and then we move on to disinfection. Next slide, please. All right, disinfecting correctly. I just said that one thing that's very, very important is to have limited things on surfaces. So we're working with a lot of clients on keeping paper and other items off the desks and other surfaces throughout the facility. And we're going through and we're continuously wiping down those surfaces, cleaning those surfaces. In the event that we have to disinfect, those surfaces are already cleaned, and then we can just move right into disinfecting. All right, PPE, having the personal protection equipment, the right equipment. This is something that we're seeing that a lot of clients are not. So we got from a client perspective, and we also have some prospective clients, if you will, people we don't do business with, are questioning how their facility is being cleaned. And what we see a lot of times is people that are doing the cleaning, they don't have the proper PPE, or they don't have access to the PPP, or they're not using the PPP correctly. So if you can see my cleaner on the left, and this is a common cleaning process here. So she's using a microfiber cleaning cloth, she's wearing gloves, and then you can see she's got a conventional cleaner. So one thing we're also very big on in educating our folks and educating clients is, you can see the bottle she uses. On the back of that bottle is a lot of instructions, a lot of detail, and that detail will also tell you what proper PPE you should be using. In the case of a disinfectant, it will tell you the proper dwell time. So we highly, highly encourage people to understand, not only have the proper PPE, but to understand the label that's on the back of the bottle. So you can see she's not wearing eye protection. So this product that she's using does not require eye protection. It does require gloves, and quite honestly, we've been using gloves for a long time. That's just been part of our cleaning program. Now on the right, you see someone who is prepared to do COVID cleanup, and that is the proper PPE from the CDC. So you'll see that gentleman is wearing gloves. He's wearing a Tyvek suit. One thing that's very important is to have long sleeve. Something covering your arms when you're doing some of these cleanups. And you can also see that this gentleman is not wearing goggles, and this gentleman is not wearing an N95 face mask or a ventilator. You're going to see a photo a little bit later on where we do have a ventilator, but we're doing a different procedure. We're doing an actual COVID cleanup, and we're fogging.
So we had a question come in. Does the business, ours is a manufacturing facility, need to close until full facility / machine specific sanitizing can be done?
Yeah, I will address that. Just give me a few more slides here, and I'll get to that. That's a great question. All right, so level 1, I just went through that. That is going in and doing basic day-to-day cleaning, sanitizing surfaces. There's a big difference between an all-purpose general cleaner and a disinfectant, right? So level 1 is we are not disinfecting. We're using conventional cleaners, and we're using a product that's called alpha peroxide. It's a hydrogenated peroxide, and that's what we're using that throughout the facility for routine cleaning. In areas where this is level 2, so we work with clients on identifying high touch areas, so doorknobs, handles, could be conference room, tables, chairs, restroom, any area throughout the facility that multiple people are touching. So in those cases, we're working with the client, and we're basically mapping out their facility, and we're creating a disinfectant high touch cleaning program. Now level 3 this is emergency response. So this is when we're we're going into facilities with a suspected case of COVID and a confirmed case of COVID. By the way, we're treating both those the same, because there's this unknown where you have somebody in a facility who might not be coming into work today because they're showing symptoms, or they've left the workplace showing symptoms. They're at home. They might have done the virtual checklist, so it looks like they have COVID, but it hasn't been confirmed. So this is probably the scariest piece here for our customers and our employees here too, as well as facilities we clean, is that with the lack of tests, we're just not sure if it's a confirmed case. So that's why we're treating level 3 the same. If it's a suspected or a confirmed case, we're handling that cleanup the same. So routine 1, I've already gone through most of the procedures with the general cleaning and sanitation. Number 2. So here's level 2. Again, I can't stress enough, having the proper PPE and understanding those labels. Disinfectant is a product that is hard for us to source, but we've been able to source. So I'm getting calls every day, in regards to sanitizer, disinfectant wipes, and do you guys have disinfectant? So we're finding customers just they either don't have access to this, or they've ran out and they're scrambling to get this stuff. And by the way, if you look at some of these numbers, you can see that we haven't hit the apex yet. They're projecting that to be 2 to 3 weeks. So having the proper products, I'm recommending to our clients not to store for the next 3 to 4 months. Let's just take a look at the next 30 days and make sure we have adequate supplies. Next slide, please. Okay. All right. So again, if it's a suspected case or it is a confirmed case, we're treating that the same. So the question in regards to manufacturing, we have a lot of essential businesses that are open either 1, 2, and 3 shifts. We have call centers that can't afford to shut down. I got manufacturers that can't afford to shut down. So in an ideal situation with a suspected case of COVID or a confirmed case of COVID, the ideal situation is to try to lock up those areas as best as we can, working with the customer. Again, we have some time to get in to do that cleanup. We'd like to get in there within 24 hours, but it's not always the case. I think we were on 2 calls yesterday of facilities that could not afford a shutdown. So we were at one customer within 60 minutes, and then we were at another customer, one was in Madison and the other one was in Milwaukee. So I think we had the one in Madison, we were there within, I think, 2 hours, and within 3 hours, we had that area that was quarantine blocked off. We had that cleaned up, and the employees were back to work in those areas. It's kind of scary stuff. I'm not gonna lie to you. If you guys haven't experienced a suspected case or a confirmed case, it really freaks people out. So there's back to your contingency plan is working with your staff and just calming them on the way you're approaching cleaning, the way you're approaching the sanitation, and the way you're approaching in the event of a suspected or confirmed case, what you plan on doing. Because when they see it for the first time, there's a lot of panic. And I shouldn't say first time. We've been back to the same facility a few times. Thankfully, I don't think we've been back to the same place 3 times, but it's changing every day, right? So, so I hope that answers the question. Manufacturing is Cassie, did you omit that last slide with the COVID cleanup? Totally? Or did you get my new slide? Okay, that's okay. You guys, unfortunately, I had to omit my last slide, and it was a photo of us on a confirmed case of COVID. This was an individual that he was in the facility. He wasn't an employee, but he was a contractor, and he was mentioning that he hadn't been feeling well, and somebody was smart enough to send him home, if you will. He was a contractor, so they didn't send him to HR, but they had him removed from the facility immediately. He was able to get tested. He was a physician, and he was confirmed. So I had a photo of the cleanup of that particular one. However, I didn't have the blessing of that client, and I wasn't able to get it yesterday, so I wasn't able to include it. But it's just basically, it's a photo of us fogging the place. And I use the term fogly, but I use it loosely because a lot of people have this, it's almost like we're Ghostbusters, right? Where everybody vacates the building and we come in with these units and, send out this huge fog, and it kills everything everywhere. It's a mist, so it's electrostatic machine that we come in, and they are handheld guns. One of the cool things about it is it doesn't use a whole lot of disinfectant because of that mist that it sprays. But what's cool about that mist is that mist shoots out and it's able to get horizontal and vertical surfaces. Another thing with disinfectant, there's a dwell time. So this is a common misnomer that we see where cleaning companies and people are disinfecting areas, but they're not letting that dwell time. They're just wiping those surfaces. So there's a high chance it's not going to kill the COVID-19 if I take a disinfectant and I wipe a surface and I'm not letting that disinfectant work on that surface. So in most cases, a minimal of 2 minutes, and the surface has to remain wet. In some cases, some of these labels on disinfectants, it could be as high as 10 minutes. So you can see the importance of disinfecting. So with those foggers, it allows us to come in and put the disinfectant, in the electrostatic machine. It sprays that mist out of that disinfectant, and it has the surface has that proper dwell time. And like I said, we're able to get horizontal and vertical surfaces. In some cases in manufacturing, we're going up on some scissor lifts, making sure we get some pretty high areas. Back to that 6-foot projectile, if you got a gentleman who's 6 feet and he sneezes and it goes up, the COVID, of course, can stay on that surface. So, but generally we're finding the disinfecting from 6 feet and lower on horizontal and vertical surfaces. So in regards to staying, getting back to, what you guys need to do is have that, if your contingency plan should have where people are going throughout the facility. We're working with clients on limiting the places they go. So if there's 4 accesses, if there's 4 different men's restroom, let's say, or women's men and ladies restrooms in manufacturing, we're working with clients limiting to which restroom they go to. So trying to divide the building up into quads, if you will. Same thing with break areas. So in the case if there is a suspected or confirmed case, we know where that individual's been within the facility as long as they stay in those quadrants. So in manufacturing, let's just say quadrant 3, there's a suspected or confirmed case. We're able to go into quadrant 3 and properly disinfect that area. So quadrant 1, 2, and 4 are still open. So that is
all right.
And everybody on this call, you guys have my information. I'm fielding calls, every day, all day. The only benefit that I see that I've had here in the last 3 weeks is I've done all my meetings through Zoom or a telephone call or Microsoft Teams. So it's allowed me to be very efficient. So please, by all means, I think I left my mobile phone up there. If you have any questions for us, please call.
Thank you, Scott. Appreciate you being part of our webinar here. Cassie, do we have any other additional questions that have come in?
Yes, so if you guys would like to start typing in your questions to the Q&A feature, we will address them now at this time. We did have one come in while Scott was talking about the different levels of cleaning. What type of training do you need for each level?
So level 1, that's pretty basic of just using general general all-purpose cleaner, on a horizontal surface, glass cleaner, and just a conventional cleaner. But still, the training piece comes in as the back of the label will tell you what proper PPE you should wear, and it'll tell you how that product should be used. On level 2, when we're doing some sanitation and could be some disinfecting, again, the proper PPE is needed and reading the back of the label. I'm always amazed at how many people grab a product and don't read the back label. So that's essential. And then obviously 3 is when we're disinfecting and fogging. There's a lot of training. So with COVID-19, I had trained technicians, but before they went out on their first confirmed case of COVID-19, I brought in a company out of St. Paul, Minnesota that specializes in biohazard cleanup. Like these guys work with the government as far as cleaning up like nuclear waste, so I tried to source the best I could possibly find within driving distance. So I found this company out of Minnesota, and they spent 2 full days training our technicians on specifically for COVID related, and then having the proper procedures, policies, proper PPE, the proper disinfectants. We were seeing a lot of outdated disinfectants, and then having, of course, the proper equipment. These foggers are hard to find.
The other thing I would add too is don't forget about your hazard communication training. This is a unique product. Some of these are unique products, as Scott said.
Yes.
And also this does kind of tie into your bloodborne pathogens exposure control plan, so that you might want to tie this into that.
All right, we've got about 4 more minutes left. Another question came in. If an employee tests positive for COVID, they can only return to work once they're symptom-free for 72 hours without fever-reducing medication. But is it 7 days since symptoms first appeared or 14 days? I've seen conflicting info on 7 days versus 14 days.
Jeff, you want to take that one?
Oh, I just want to make sure I give the proper information on that. I do believe it's 7 days. It's 7 days after your the symptoms first come into play, and then after that, and then it's 72 hours after they've no longer had the symptoms. Does that clear that up? Does that answer that question?
I think so. Thanks, Jeff. They replied, so it's 7 days then?
Correct.
Perfect. Well, it looks like we are going to wrap this up here. I'm just going to leave with one more poll question that Scott was interested in sharing.
So this question I have is more, well, I was gonna say for the state of Wisconsin. However, I think we're probably gonna see all states combining on trying to keep the social distance and the safer at home.
Yeah, so it looks like everyone's a little divided on the answers, with most people entering either more than a month or over 3 months. Well, great. It's great to get that response from you guys and kind of see what we're all at. And at that point, I think we just want to thank you guys so much for joining us for this webinar. Thanks for bearing with some of the technical and audio issues. We're all learning these remote things as we go. Just again, if you could finish that survey at the end, we would love to get your feedback. And if you would like to join us, we also have an upcoming webinar tomorrow, and it will be at 9:30 a.m. and it will be on the COVID impact to employer health plan cost. If that is something you are interested in attending, you can register on our website. Thank you again to our panelists. We are glad to have you here and have a wonderful rest of your morning.
Thanks, everyone.
Thanks, everybody. Stay safe out there.
Thank you, guys.